And therefore, it makes sense to give a pill to these patients. How does CoQ10 act? It acts by energizing the cell, converting ATP into ADP, and ADP, which is again converted to ATP through the mopping up of the nascent oxygen. And that results in twofold action. One, it prevents the damage to the cell, and secondly, it gives energy to the cell. And that's why most of the gynecologists are very fond of giving this enzyme. L-carnitine, the main function is in the mitochondria, which if there are low concentrations, that leads to decreased sperm motility. And it provides, look at the bottom line, L-carnitine provides readily available energy for use by spermatozoa, which positively affects sperm motility, maturation, and spermatogenesis process. Then we talk about lycopene. Lycopene is a substance which is found in tomatoes, watermelon, guava, and other red fruits. However, you have to take a lot of quantity of tomatoes to be able to get the lycopene, which one small pill can give to you. It acts again by preventing damage to the cell membrane, by preventing damage to the DNA molecules, to lipids and proteins. So it acts at all the levels. Zinc. Zinc is a substance which not only increases the sperm count, but also improves the testosterone levels. Therefore, it works two ways. It works for erectile function as well as for male infertility. Now, those of you who are going to take zinc just now, don't take it, because it does not increase the potency to that extent. So it accelerates the onset of sexual function. It improves sperm count, sperm motility and morphology, improves testicular concentration, and improves sexual potency. Arginine is thought to be essential for sperm motility, and you have to give a very high dose, 4 grams a day. Selenium is another one. Now, this is the only micronutrient that can be toxic if given in excess. The rest can be given in any amounts. Methylcobalamin, its effectivity has not been shown. Effectivity is only in just over 20% of infertile male. Vitamin E, there have been very few human studies, so it's more or less empirical. So what is an ideal nutraceutical? Wouldn't it be nice to have one pill instead of taking 4 pills? A pill that can combine L-carnitine, CoQ10, lycopene, and zinc, and that can provide a holistic approach to male infertility, just like the holistic approach to sexual dysfunction. And this ideal nutraceutical should have CoQ10, which will improve the sperm motility, L-carnitine, which will again improve the sperm motility, lycopene, which improves the count and morphology, and zinc, which improves sperm production and maturation, as well as testicular testosterone synthesis. Take-home message that male infertility is a reality, and idiopathic male infertility is the most common etiological factor for male infertility. Antioxidants like lycopene and sperm energizers like CoQ10 and carnitine can be good options for the treatment of idiopathic male infertility. And for patients with non-obstructive azoospermia who have sperms in their testicular biopsy, ICSI, send the patient to Anup. Thank you, ladies and gentlemen. This is perhaps the only positive thing of global warming, that the underwear has become smaller over the years. I think they've even got Bipasha Basu's output there. Thank you very much.
Excellent presentation, Dr. Saxena. And let me tell you, a brief 2-line message is, anybody and everybody in some phase of their life, male people, will have sexual dysfunction, so don't feel shy. Come to Dr. Ajit Saxena. It is treatable. And don't worry about it. And sexual life, I feel, is as important as a heart, So if you have a good heart, you can have a good sex life, and vice versa. Thank you. No, drug. First you control diabetes and then drugs. And if you have no cardiac involvement, I feel Viagra and all, they are very helpful. Yeah, see, it depends on the patient's tolerance, and if patient has pronounced symptoms of cardiac symptoms after taking Viagra, then it should be avoided.
Thank you. Thank you. I think, JK, I'm only going to just conclude because we have with us our special guest lecturer, Dr. Naresh Trihani is here, the chairman of the Medanta group. I'm only going to say the gist of Dr. Ajit Saxena's lecture is, age is no bar. Enjoy the evening today. Enjoy the drinks today in the evening. And if you find any problem in the night, call Dr. Ajit Saxena tomorrow morning. Thank you, Dr. Anoop, and thank you, Dr. Kabiri.